Hello and thank you so much for joining us. Whether you're watching on TV or online, I'm Anthony Robart. We are waiting for the latest update from Prime Minister Justin Trudeau. That is in about 15 minutes or so. He will walk out of his home at Rideau Cottage in Ottawa, where he has remained in self-isolation for several weeks now. So while we wait, let's bring you up to speed on some developing news. And we begin, as we have every day, with the numbers. Globally, there are more than 70,000 people who have lost their lives to COVID-19. Now close to 1.3 million confirmed cases of coronavirus around the world. The United States is approaching 340,000 cases, the death toll nearing 10,000. With American officials warning this week will be the country's worst yet in terms of fatalities. In Canada, more than 15,000 people have tested positive. So here's where the Canadian infection numbers stand today. Quebec remains the worst hit province. That province reporting close to 8,000 cases. That works out to more than half the national total. In Ontario, there are more than 4,300 confirmed cases. In Alberta, about 1,250 cases. BC now shows more than 1,200 people infected. Across Canada, more than 280 people have died. Well, today is the first day that unemployed Canadians can apply for Ottawa's COVID-19 benefit program. The $2,000 a month grant is aimed at helping those who have lost their jobs or are unable to work because of COVID-19. More than 2 million people were laid off last month as businesses were forced to close or reduce operations. The government is trying to prevent its website from crashing under the weight of applications by asking Canadians to apply based on their month of birth. All right, let's go to Ottawa now, where Global's Abigail Beeman is standing by. And Abigail, let's begin with the CERB program and questions about whether the rollout is going well. It just started. Any gaps, any problems so far that we can report?
Well, yeah, as you say, it just started, and in order to prevent the system from being completely overwhelmed because of the volume of people who are looking to apply here, today the system is only open to Canadians who were born, whose birth month is January, February, or March, and then tomorrow it will be the following 3 months. This is in an effort to not overload the system all at once. We also know that this morning the CRA released some phone numbers that people can call for more information. In addition to that online portal where you can apply, there are 3 phone numbers now from the CRA. 2 are automated, giving you some information or allowing you to apply by phone, and a third actually lets you speak to a real human to answer questions that you might have. So we'll see how those phone lines do and what we hear from Canadians trying to get information on that today. But when you mention gaps in the system, we have, of course, heard concerns about people who won't be eligible for this direct funds. And a reminder, this is a $500 a week direct funds for Canadians who have lost their job as a result of COVID-19. You have to show that you earned $5,000 in the last year and that your income has gone down to 0 for 14 days. So a lot of concern about some people who wouldn't apply, say if they were still working, a few hours a week, that would make you ineligible. Also, people who were out of work before coronavirus started but not eligible for EI. If you were eligible for EI, Canadians who have already signed up for EI do not need to reapply. That will automatically roll over into the new CERB. Also, a lot of questions about post-secondary students. In the beginning, when this was first announced, it looked like they'd be eligible. New information on the government website says if you have had a summer job lined up and that got canceled because of the coronavirus, post-secondary students are not eligible. We did hear from the Prime Minister over the weekend that he is looking at that, aware of that, but those are just a few examples of concerns over people who will not be able to access this new funding.
Obviously, you can imagine the Prime Minister facing a number of questions today. That's coming up in about 11 minutes, give or take. We'll, of course, bring that to you live. But let's talk about the address and what we can expect today. What are you hearing?
So we're hearing that we will hear the Prime Minister discuss the CERB more. I mean, we just spoke for a couple of minutes and still there's a lot to address here. We know so many Canadians have questions. I receive messages all the time from people wondering, are they eligible? How do they apply? So I believe that the Prime Minister will be hammering home the message of how to apply for this, who is eligible, the fact that this opens today, and we'll hear more from him on the Canadian Emergency Response Benefit. We are also expecting expecting to hear from the Prime Minister about interest rates from the big banks for credit cards. We know that that's something that Ottawa had been pushing the big banks to do, to lower interest rates for Canadians in need. And over the weekend, we saw some tweets from the Finance Minister showing progress in that department, saying that the big banks had agreed to lower credit card rates for people who were impacted financially by the coronavirus. So we are expecting to hear more from the Prime Minister on that front.
All right, I want to shift to the issue of procurement of protective equipment, a huge issue. We've been hearing of the imminent shortage for many provinces, including Ontario and Quebec. Where are we on that front in terms of the procurement of this equipment?
So in order to set the stage, the big announcement came from the government last week about how $2 billion was being set aside to deal with this. And the day that that announcement was made, we had some, but not all details of the full picture here. A commitment to procure 157 million masks. In addition, tens of millions of N95 masks in specific. Over the weekend, we heard the Prime Minister say that millions more masks would arrive from China within 48 hours, but still a lot of questions about just how much we need. And of course, we don't have a full picture of how much we need because we don't know exactly how many Canadians and how many frontline healthcare workers will need that equipment in terms of masks, Canadians needing ventilators in terms of patients here. But part of the announcement, which was important last week, talked about how the government had already signed contracts with 3 Canadian companies and was moving forward with 5 more companies in order to produce more of this equipment here at home. Because, of course, a large part of this global challenge is that globally everybody is trying to get their hands on this equipment. So the more that Canada is able to produce at home will help to alleviate some of that pressure.
Abigail, we'll have to leave it there for now. Thank you so much. Shifting to other news now, and you may have noticed more police enforcement in recent days. As the weather gets warmer, officers across the country are now cracking down on physical distancing measures. In most cities and towns, violators will receive a fine ranging from $750 to $5,000. Nova Scotia appears to be one of the strictest provinces. Police there have handed out more than 50 tickets already in connection to physical distancing violations. Officers are also patrolling for non-essential businesses still open. We're seeing that. Meantime, south of the border, there was a slight dip in new coronavirus deaths in New York over the weekend. Overall, very grim numbers. On Sunday, New York State reported 594 deaths. This is actually down from 630 a day before. COVID-19 has killed nearly 4,200 people in New York. Meanwhile, the U.S. government has deployed 1,000 military personnel to New York City to help with the containment effort. U.S. health officials are warning of an increase in deaths across the country this week, calling the next 7 days critical, even saying this could be their 9/11 or their Pearl Harbor moment. Obviously a difficult situation in the United States. Overseas, the UK Prime Minister Boris Johnson remains in hospital with COVID-19 symptoms. European Bureau Chief Crystal Gomensing joins us now from London with the latest. Hello, Crystal. Any status condition on his health at this point?
Yeah, we know he is still in hospital. He is there for observations. The spokesperson for the PM saying that he has been struggling with a cough as well as a fever. Boris Johnson himself took to social media earlier today to sort of update everyone on his status, saying that, he was admitted to hospital as a precautionary step on the advice of his doctors. He was saying on Twitter that he's actually in pretty good spirits and thanked everyone at the National Health Service who is taking good care of him. We know that he has been struggling with this cough and fever for several days now. It was on Friday that he took again to social media to say that he was extending his self-isolation. He has been there for about 10 days, and that's sort of the concern, that he wasn't necessarily getting any better. And so the advice of doctors was to go to hospital. He was admitted Sunday evening. Again, officials in Downing Street saying it was not an emergency situation. He was admitted as a precaution and that they're awaiting some test results.
And the Queen on Sunday made a historic and rare address to the UK and the Commonwealth regarding the pandemic. How was that received?
Yeah, absolutely. It was a rare address. It wasn't very long, less than 5 minutes, but we haven't heard these sort of messages from the Queen very often, only 5, in fact, in her 68-year reign. It sort of struck the tone that everyone was expecting from her. It was warm and reassuring. She addressed the financial hardship that so many people are experiencing right now, talked about the isolation, of course, her own family hit by the virus. Prince Charles was infected and is now out of isolation. So she talked a little bit about how it can be difficult, but during these difficult times, hopefully everyone can be proud of how they responded in the future. And one of the lines that's getting the most attention is when she said that better days will return. We'll see our family again. We'll see our friends again. We'll meet again. So it struck the tone that everyone was hoping, and that message played all around the world, not just in the Commonwealth. And at one point, she was trending online. So it was a bit of reassurance that I think many in the world needed.
Yeah, you touched on that. I mean, she remains a symbol of poise and calmness within all this really uncertainty. And she harkened back to 1940, her first address to the nation during World War II. So that was interesting. I want to talk about physical distancing. I saw some images over the weekend which reflect really the situation that people are not necessarily adhering to not just the recommendations, but the orders. What are you seeing, and are there stricter measures on the horizon given all this?
Yeah, well, let's highlight that right now, that it is an order. It is a rule. This is legislation. The UK is in a lockdown, but, I went out on Sunday just to gather some material, and there are a lot of people who were just at the park sunbathing in groups that they shouldn't have been, not observing that 2-meter rule. Police were out also at parks kind of shooing people away, saying, no, I understand that you think you're supposed to be here and you can, and people are allowed to go out to exercise, but officials are saying there's a difference between going out and getting a little bit of fresh air, it's good for the body and the mind, and sunbathing, and that's what we're seeing. Matt Hancock, the health secretary, has again just urged people to not bend these rules, that there's a reason that they are there, and all officials are saying it is a minority, but it is a problem because we know that without cooperation, without people actually adhering to the lockdown measures, it affects the infections and, of course, the death rate.
All right, Crystal, we'll have to leave it there for now. Thank you so much, Crystal Gamansing, joining us from London. And if you are just joining us, we are awaiting the Prime Minister's address to the nation. That is expected any minute now. That is a shot of Rideau Cottage, and you might notice a hockey stick outside the door. This, as you may know, is the 2-year anniversary, the tragic anniversary of the Humboldt Broncos bus crash. That is a scene that we have seen played out across the country as people put out their sticks in tribute to the 16 people who lost their lives that day. Now, for those looking to apply for the Canadian Emergency Benefit Program over the phone, there you see the numbers. The CRA has just released the number you should call. Applicants will need to have their social insurance numbers and the postal code handy. All right, so let's bring in our Ottawa Bureau Chief, Mercedes Stevenson, now. Mercedes, of course, one of the big stories that we're talking about is the launch of the CERB program. And Abigail touched on this, some of the gaps and the confusion surrounding this, who is and who is not eligible. Talk about that if you can, expand on where we are and any chance that that could change.
Well, I don't want to predict going forward. So far, they've been adjusting it with fair regularity to try to deal with this. But this is a program that is explicitly designed to help those who have lost their jobs or their income due to COVID-19, not other reasons or who were on pre-existing programs. It's explicit for that, or folks who are unable to work because they're sick with COVID-19 or caring for somebody who's sick with COVID-19 or home caring for children because of COVID-19. So that's really who this is targeted at, is people who have directly borne the brunt on their income. You have to have made at least $5,000 in the past.
All right, we have some technical issues with Mercedes, and we'll try to regain some connection right now. And just to recap with the CERB, I mean, some of the big problems right now is, students who are looking to apply, that is one of the big issues because, they're not necessarily making money. You have to make as much as, you have to make $5,000 over the past year, over the past 12 months to apply. And even if you were working even a few hours, you're not eligible. So there are some issues when it comes to that. We'll try to unpack some of that and try to answer some of the questions because there are obviously a lot of people who are not able to apply. So any second, we're awaiting the Prime Minister's address. This is from outside his home in Ottawa at Rideau Cottage. There you see him walking to the podium. Let's listen in.
Bonjour à tous. I want to start this morning by recognizing that today is a painful anniversary. It has now been 2 years since the tragic Humboldt Broncos crash. From coast to coast to coast, we remember the 16 lives that ended much too soon and the many more that were changed forever. If you lost a friend, a teammate, or a loved one, if you're still rebuilding and recovering, I want you to know that we're here for you, and we will always be here for you. You, the community of Humboldt, along with all Canadians who stand with you, have shown incredible strength and resilience. And just like the people putting out hockey sticks or wearing the jersey, you remind us that together we can get through even the darkest of times. Right now, as we face a challenge unlike any other, we lean on our friends and family, and we let them know that they can lean on us, too. The weeks and months ahead won't be easy, but we're going to get through this together. I'm sure many of you watched the Queen's address yesterday afternoon, and her message of unity and resolve is more important than ever. No one should feel alone in this. No one should wonder how they'll weather this storm without support. Over the past few weeks, we've brought in a whole range of new measures to help families and workers, seniors and business owners get through this. Taken together, we've introduced the biggest economic measures in our lifetime, which will help millions of people. That includes the Canada Emergency Response Benefit for if you've lost your paycheck. Whether you're taking care of someone who's sick, have been laid off, or are living with a disability, the CERB is there for you. This benefit is now available starting today. If you're born in January, February, or March, you can go to canada.ca and apply online. If you can't apply online, don't worry. You can call 1-800-959-2041. Since it opened this morning, 240,000 people have already successfully applied. For everyone else, you'll be able to apply another day this week, depending on your birth month. We know you need this support as soon as possible. We have to make sure this system works for everyone. If you're using direct deposit, you'll receive money 3 to 5 days later. The CERB is meant to help all Canadians who need it, and millions of Canadians will be getting it starting this week. But there are some people who don't yet qualify who we do need to help. If you're working reduced hours, down to 10 hours a week or less, we will soon announce how you will be able to qualify for the CERB. This is to help you if you're a gig worker, a contract worker, or a volunteer firefighter. We'll also have more to say for those who are working, but making less than they would with the benefit. I'm thinking in particular of home care workers or long-term care workers looking after vulnerable seniors. And I know there are also lots of university or college students wondering what kind of job you'll get this summer. You need support now, and work is underway to get it to you as soon as possible. For people in all of these situations, we see you. We're going to be there for you. And we're working as hard as we can to get you the support you need. At the same time, we also announced a new 75% wage subsidy to help you keep your job and help businesses keep their employees on the payroll. Right now, we're drafting legislation and talking to other parties ahead of bringing Parliament back to put the wage subsidy in place as quickly as possible. Supporting you and your family is our top priority. Your Minister of Finance, Bill Morneau, will have more updates soon, but here's the bottom line. Whatever your situation, we are working to get you the help you need. Si vous êtes né en janvier, en février ou en mars,
if you are born in January, February, or March and you've had to stop working because of COVID-19, you can make a request for the Canada Emergency Response Benefit as of today at canada.ca. Otherwise, you can send a request later on in the week. Many people need help quickly, and we have to make sure that the system is working for everyone. If you opt for direct deposit, it should take 3 to 5 days to receive a first payment. The Canada Emergency Response Benefit seeks to help all Canadians that need help. I know that some people will need help and are not yet eligible. If you have reduced work hours, for example, to 10 hours a week or less, we will announce how you will also be eligible for the Canada Emergency Response Benefit. We will also have news for those who are earning less money now than if they were receiving the benefit. For example, home care workers or those who are taking care of the elderly. There are many university and college students who are wondering what they're going to do this summer. You also need help, and we're working hard to find solutions for you. We're working on a bill and we're cooperating with the opposition parties to implement the measures that were announced as quickly as possible. Bill Morneau, the Minister of Finance, will provide more details soon. But here is what you need to know. Regardless of your circumstance, we're doing everything in our power to help you. We're working extremely hard to help you and your family so that you're able to manage your finances. Banks have an important role to play because they have the ability to help businesses continue and to help families to pay their bills and their mortgage. I would like to thank the 6 largest banks and some co-ops because they reduced by half the interest rates for credit cards for Canadians having financial difficulties because of the pandemic.
Major banks and of certain credit unions to cut credit card interest rates almost in half for people in financial difficulty because of the pandemic will give them much needed relief on debt. I also want to thank Minister Morneau for his outstanding leadership on this. And we need to see even more action like this going forward because this is a time to think about each other, not about the bottom line. On that note, I want to recognize the new initiative the Canadian Chamber of Commerce launched in partnership with our government. The Canadian Business Resilience Network will help businesses of all sizes get through this tough period, not just get through this tough period, but drive our economic recovery afterwards. This builds on what we've already done to help business owners. We have a 3-point economic plan. It supports business owners, including through new loans, while safeguarding jobs with the wage subsidy and helping those who no longer have a paycheck with the CERB. We're here for you. In order to get through this and keep our loved ones and our frontline workers safe, all Canadians need to do their part. Don't forget that you are shaping our future today. What the next weeks and months look like depends on you. It depends on whether you stay home, whether you help protect the vulnerable and make sure our hospitals aren't overwhelmed. Chaque citoyen doit faire sa part.
Everyone has to do their share. Those who have to continue to go to work, nurses, doctors, lab technicians, truck drivers, farmers, Everyone is doing their part. They are making sacrifices to allow the rest of the population to stay home. The best way to thank these people is to continue to follow the guidelines of healthcare experts. That is how we can protect our health and their health as well. Thank you.
Monsieur le Premier ministre, on va maintenant passer à la période de questions en commençant par le téléphone. Modérateur, c'est à vous.
Thank you. Merci. The first question, Alex Ballingal, Toronto Star. Line is open.
Good morning, Prime Minister. Premier Ford in Ontario reportedly told CBC News this morning that Ontario could run out of personal protective equipment within a week, and that the U.S. has stopped a shipment of equipment last night. I'm wondering what your reaction to that is, that impending shortage in Ontario, and can you tell us if the U.S. has actually stopped any shipments of goods into Canada?
We are working very closely with all provinces and monitoring the levels of personal protective equipment and the challenges they're facing both on procurement and on making sure that our health officials, healthcare workers across the country get the kind of help that they need. We continue to have productive and positive conversations with the United States, emphasizing for them that healthcare supplies and workers across the border are very much a two-way street, and we need to continue to enable us to be there for our neighbors because it's in our collective interest. Minister Champagne had a good conversation with Secretary Pompeo this morning. Those conversations are continuing, and we expect those supplies to be delivered.
Since the beginning, we've been working with the provincial premiers to make sure that we have sufficient equipment to protect the healthcare workers. We're fully aware of the concerns that people have, that we might run out of PPE during the weeks to come. That's why we're working so hard to source this equipment throughout the world and also to produce domestically. I would like to highlight that we continue to have very productive conversations with the Americans. Minister Champagne had a discussion with Secretary Pompeo this morning, and we expect that these products will be delivered.
Have you, I guess just to repeat that question has there been any shipments that have been stopped that we were expecting to get? And have you received any assurances from the Americans that they will allow these to go through?
As I said, there are very productive conversations ongoing, and we expect those shipments to be delivered.
Thank you. Next question.
Thank you. Merci. Next question, Jim Bronskill, the Canadian Press. Line is open.
Good morning. We're wondering if you can update us on any of the efforts to ensure that people are quarantined who need to be quarantined. Do you have anything to tell us today about whether anyone has been quarantined? And if so, are there any numbers on that score? Thank you.
Anyone returning to Canada is subject to a mandatory quarantine order. That means they have to go straight home from the airport and stay home for 14 days. Public health officials are following up with a number of those people, particularly some of the higher risk or challenging cases. We are confident that Canadians right across the country are obeying the quarantine orders and making sure that they're doing everything they need to do to keep themselves and their loved ones safe.
Follow-up question?
Is there any sense beyond the normal quarantine procedures whether the Quarantine Act has been invoked in special cases and people have actually been forced into quarantine in centres or other locations under the Quarantine Act?
From the very beginning, there was a number of measures that we took on returning flights from Wuhan, for example, on flights coming back from various cruises, where we had mandatory quarantines in centres. We have facilities available for people who are returning to Canada and for various reasons cannot quarantine themselves at home, or home is too far from the airport. That is why we have institutions in place, and those are being used.
Merci beaucoup. Prochaine question.
Thank you. Merci. Prochaine question. Raymond Filion, TVA, à vous.
Raymond Filion, TVA. Good morning. You said a little bit more than a week ago that you were at the end of your quarantine period. Could you tell us when your quarantine will end and when are you going back to the office? I expect to go back to the office in the days to come. My work will continue to be done from home. This is what we're asking everyone to do. We're asking people to stay home, if possible. And as we've been showing for several weeks now, it's possible to work from home in this situation. Yes, I might have to go to the House of Commons or to the office at some points in the days and the weeks to come, but I will work from home as much as possible. You also mentioned earlier that you spoke about weeks and months to come and that this will be difficult. I understand that the curve depends on people's choices and that data will be published soon. What does this mean, really? What it means is that people have to expect to continue staying at home for several weeks to come and several months to come. We will have more specific answers as we create predictive models that will give us a better idea of what could happen. Each model shows us a lot of variability, and all of this depends on our collective actions, our actions as a society, as individuals, staying at home and to continue with social distancing is the best way of flattening the curve, but this is going to last several weeks and perhaps several months.
Thank you. Merci. Dernière question, Marie Vastel, Le Devoir, à vous.
Marie Vastel, Le Devoir. Yes, I'd like to come back to the subject of the House of Commons. The session has been suspended for 3 weeks, and the opposition feels that they're being set aside in this democratic process, and you're a minority government. What do you have to say to those who think that you're going around the democratic process and governing alone? No, on the contrary. This is why we are bringing back Parliament to debate on extremely important legislation with regards to helping workers and businesses with the wage subsidy. I'm looking forward to the House of Commons reopening in a reduced capacity to continue doing the important work of parliamentarians. Let us highlight that there are many MPs throughout the country that have been elected to represent their riding, and they cannot come to the House of Commons in this very unique situation. And this is why we're seriously looking at the different ways of having a virtual House of Commons. We know that it's important to allow our democracy to continue working, to give the opportunity to all the MPs and not just those who have the ability or are close to the House of Commons to represent their citizens. And we're going to continue working on this in the days and the weeks to come. Now, on this idea of virtual parliament, what would this look like? You would be present every day. What would this look like? Would you want something more flexible during the crisis? Perhaps you have many things to do. There are a lot of very good ideas as to how we can make our institutions and our processes more robust. I think that is more important than ever to have a strong democracy, to have strong institutions during a crisis. This is why we're working with the other parties and with our institutions and the parliamentary experts to try to find how we can continue to ensure trust and how to ensure that our democracy remains strong even in these very trying times.
Really important that we continue to strengthen our democracy even during a crisis, especially during a crisis. That's why I'm looking forward to seeing Parliament reconvene in a reduced state in the coming days to be able to pass important legislation that's going to get wage subsidies out to employers so people can continue to hold their jobs even in this time where very few people are working. But more than that, we have to look at ways of virtually convening Parliament so that parliamentarians from across the country who were elected to do their jobs of representing their citizens in normal times and in times of crisis can make themselves heard. It can't be just about folks who have proximity to Parliament or the ability to get here. We need to look at ways that our democracy and our institutions can stay strong and embody and fulfill the functions that Canadians need them to. That's why I'm very much looking forward to discussions with other parties and experts on how we can continue with our institutions even in this difficult time.
Bonjour, Monsieur le Premier ministre. Christian Noël de Radio-Canada. J'ai pas changé de nom de famille encore.
Christian Noël, Radio-Canada.
La prestation canadienne universelle pour l'urgence.
Now, if we talk about the Canada Emergency Response Benefit, a lot of people are falling through the cracks and they're wondering how they're going to get by. What changes are you going to bring to this? And when is this going to be available? Will it be retroactive? We're looking at many different profiles of people who are falling between the cracks of the CERB. Some people have seen their work hours reduced significantly, but they're continuing work, and they should have access to this benefit. We're talking about people who are perhaps working 10 hours a week and who are earning $500 a month, and they should have access to the benefit, and we'll see how we can make sure that they can apply, be eligible, and receive the Canadian Emergency Response Benefit. We also recognize that in some settings, for example, nursing homes and others, there are workers who are earning less per month while doing extremely important work for society, but they're earning less per month than what they would receive if they were not working and were receiving the emergency response benefit. So we want to make sure that these people who are doing this important work are able to continue to do so. And we're looking at different ways how to provide more money so that they can continue doing this essential work. We will have more things to announce in the days to come.
The Canada Emergency Response Benefit is there to help millions of Canadians. We've moved quickly on it to try and help as many people as we possibly can, as quickly as possible, and that's rolling out today. But at the same time, we recognize that there are groups of people who aren't benefiting from the Canada Emergency Response Benefit who probably should. I think specifically of people who've seen their hours reduced massively down to 10 hours a week or less, maybe making a total of $500 a month, who are in a precarious situation, who really would and should benefit from the Canada Emergency Response Benefit. So we're going to be announcing in the coming days how people in that situation will be able to apply and receive the Canada Emergency Response Benefit. Think of other groups of people who, perhaps people working in long-term care facilities or seniors' residences who do extremely important work, particularly these days, but who actually don't make as much per month as they would if they had lost their job and were receiving the response benefit. That's why we're looking carefully at how we can increase their pay a little bit so that they do better off remaining at work rather than receiving, going off work and receiving the emergency response benefit. These are fine-tunings that we knew we would have to do because in any program you're trying to help as many people as possible. There will be exceptions that we have to fill, and we're going to keep working to make sure that we get this right and get everyone the help they need.
Pour ce qui est des petites et moyennes entreprises, parce que la croissance
For small and medium-sized businesses now, if we look at economic growth for the second quarter, it's not going to be growth. And so the small and medium-sized businesses are the motors of the economy. This 75% wage subsidy is not sufficient for some businesses. So do you understand how we're going to try to adjust? We're now in a situation where what we have to do to counteract the health crisis is having a negative impact and creating an economic crisis as well. But this is the choice that we must make. We must essentially stop the economy in order to weather through this healthcare crisis as quickly as possible. This will allow us then to allow for an economic recovery afterwards in a few months. Now, to weather these very difficult months, we're providing direct assistance to businesses and to workers so that we're able to go through these difficult months with the wage subsidy, with loans and credit that are accessible for small and medium-sized businesses, with funding for larger businesses as well. We are there to make sure that when the economy recovers after this healthcare crisis, we will be in a healthy economic situation, and our economic activity will recover and will be healthy.
I just want to return to that City News report about the shipment of masks. Did the United States block that shipment of masks to Canada? Are you aware of any other shipments that have been delayed or blocked? And you said that you expect the shipment to arrive. If it doesn't, what are you going to do?
Okay. We continue to have constructive and productive conversations with officials in the American administration who understand that essential services and supplies are very much a two-way street between Canada and the United States. We are interconnected and interlinked in so many ways, from primary resources flowing to American companies to make the equipment that is so desperately needed both in North America and around the world, to actual shipments of products that go from Canada to the United States, that go from the United States to Canada. We will continue to work together. We're going to make sure that goods and services that are essential continue to flow, and I expect those shipments to come in soon. Okay. Nous savons que
we know that essential goods and services go through the border, go to and from the border. And so we will do everything that we can do. We are convinced that this equipment will arrive.
The United States is recommending that people wear masks when they go out in public. Canada hasn't gone that far. Why is there a reluctance on Canada's part to make that kind of recommendation, given that some healthcare experts say it's a good idea?
I'm not going to make health recommendations to people. I don't think politicians should be opining on health solutions or fixes. I know that Dr. Tam is going to be sharing new reflections on masks in less than an hour now, and I encourage people to continue to listen to her and to health experts and professionals on how best we can keep ourselves safe, how best we can keep our loved ones safe, how best we can keep our healthcare workers safe at this time.
Brian Mullen, Global News. Prime Minister, some of the countries that have had the most success flattening the curve, such as Germany, attribute that to testing. So why aren't we doing more testing? Is it lack of people to administer the tests, lack of testing kits, or a lack of resources?
Every single day we are doing more tests than the day before. We recognize that large-scale testing is a key element of flattening the curve and dealing with the long-term prognosis of this pandemic. We will need to continue to test more and more to get those answers back quickly and be able to monitor the spread of coronavirus through our population. That's why we're continuing to do more tests. That's why we're creating more test kits. That's why we're continuing to develop new solutions on testing. Testing will be an essential part of how we get through this.
We recognize that testing is essential in order to go through this pandemic. That's why each and every day we are doing more tests. That is why we're obtaining new tests as well, a larger number of tests and tests that provide results more quickly. We know that the way to go through this is a large amount of screening.
We've already had deliveries of testing kits, and we will continue to deliver more and more testing kits from around the world, from companies in Canada that are developing them. We know there's a need for more testing kits, and that's what we're working on.
Prime Minister Kevin Gallagher, CTV National News. We're hearing that healthcare professionals, nurses, doctors are being told by hospitals on border towns, specifically Windsor and Sault Ste. Marie, they have to choose between which institutions they're going to work at. They can't work both in the United States and in Canada. Should Canadian healthcare professionals now have to make that choice to reduce the rate and potential contamination of cross-border work that they might do? Should they choose to either work in Canada or the United States?
Provincial premiers and mayors are making extremely difficult decisions and are choosing to do the right things to both protect their own citizens, their own communities, and continue to help our neighbors. We need to get that balance right, and it is going to require some difficult choices. But we know that an essential part of this path forward is not just keeping Canadians safe, which needs to be our top priority, but also helping the world deal with this global crisis, and that's what everyone's trying to do. We recognize
that the premiers and the mayors throughout the country, more particularly close to the border towns, are facing extremely difficult decisions. Their first responsibility is always to ensure the health and safety of Canadians. At the same time, we recognize that we are facing a global pandemic, and we have to be there to help our neighbors if we can.
Specifically, but I need to move on because there's another answer here that we're looking for. From this report that Premier Ford's talking about with this shipment that was blocked yesterday, are you aware of shipments of personal equipment for protecting medical personnel or any other type of shipment that has been blocked by the United States?
We have recognized over the past weeks a number of situations in which shipments coming from different countries around the world have been delayed, haven't arrived with as many products as we were hoping to see. This continues to be an ongoing problem, but specifically with the United States, we are working with them to ensure that the orders that Canada has placed get delivered. We expect those shipments to come.
We recognize that this is a reality throughout the world. Some shipments contain less equipment than was ordered, or that shipments are delayed. We will continue to make sure that Canada receives all the shipments that are ordered. Thank you.
And that wraps up Prime Minister Justin Trudeau's address to the nation. He began by paying tribute to the victims of the Humboldt Broncos bus crash 2 years ago today. There you see the hockey stick outside his door. A lot of people continue to do that in memory of those who lost their lives and the other people who were injured. Obviously a tragedy that we remember to this day. Let's go to Abigail Beeman in Ottawa. And Abigail, we heard some of the numbers. 240,000 people have already applied. That number will dramatically rise really in the coming hours and the coming days. And also, he touched on more of the CERB, and we will learn more. Maybe you can touch on that. And he referred to the people who don't yet qualify. That's the key word, yet, indicating that that will change. What did we hear about that?
Right, that was really the most significant piece of news coming out of the Prime Minister's address this morning. As we spoke about before, we heard from Justin Trudeau, there's been a lot of concern from people ineligible to apply for the CERB the way that it currently stands now. And the Prime Minister addressed three separate areas here. The big one, or the first one that he mentioned, I should say, is anyone working 10 hours a week or less. They are looking at how those people will be eligible for the CERB in future. That's a big concern for people in the gig economy, for example, or working freelance. They might be able to secure some work, but certainly their income has been drastically reduced. And right now, if you are working at all, you're not eligible for that $500 a week. So that was a big new promise coming from the Prime Minister, but no details yet. Still a wait and see with how that will apply. He also spoke about changes for post-secondary students. We talked about how they first thought they would be eligible for the CERB. Now, currently, they are ineligible for the CERB. And Justin Trudeau also spoke about workers who are working, but not necessarily making as much as that $500 a week benefit could provide them. He specifically referenced healthcare workers working to help seniors, but not hitting that $500 a week top benefit. So the Prime Minister is promising to make some changes to the plan so that those people can get help. And that was a significant number. And going back to what you pointed out about Justin Trudeau saying 240,000 people have applied, worth noting, as I believe you did too, that the program just opened this morning, but also that today, on day one of the program, only Canadians who were born in January, February, or March are eligible to apply. So when you think about how quickly that number will go up, tomorrow, the next 3 months of the calendar year will be eligible.
Well, all this giving hope to a lot of people, because there are so many people in this country who have their hand up and their hand out, because the lineup is, of course, growing with so many people in need. And, you know, the other side, there's the CERB, and then there's the wage subsidy. He talked about the, bringing back Parliament in some respect, the virtual Parliament. Any changes, any developments on that front? Anything that we could glean from what he said, and in terms of any changes to the legislation at all?
Right. So I think important to note that Trudeau said that in the coming days, a reduced Parliament would come back to pass that new legislation. So we saw over the weekend, the government House leader put out a letter that he issued to the Speaker of the House looking for ways to talk about a virtual Parliament. And that's something that Justin Trudeau said is very important going forward, especially for MPs who are far from Ottawa. And it's just not feasible to get here for an in-person Parliament, even in reduced numbers, respecting physical distancing. But the way that he was speaking suggested that for the legislation to pass, for the changes to the funding to pass, that would still be this plan that they had before of a reduced in-person Parliament. He seemed to be speaking more about in the future in general, looking at making a virtual Parliament happen. And just to recap, talking about that wage subsidy, when the Prime Minister changed the plan from a 10% wage subsidy to a 75% wage subsidy, that is talking about a lot more money than the original $107 billion economic plan that was on the table. And the Prime Minister said last week that he wants to recall Parliament so as to pass new legislation that will hand out more money through the significantly larger 75% wage subsidy.
Yeah, he's under a lot of pressure from the opposition parties to make sure this is a collective effort, especially in a minority parliament. Abigail, thank you so much. We'll have to leave it there. Abigail Beeman from Ottawa. Let's stay in Ottawa and bring in our Ottawa Bureau Chief, Mercedes Stevenson. And the other big issue, he was talking about the PPE and the stopping of the shipment at the U.S.-Canada border. Talk about that, Mercedes, and really the Prime Minister is relying on diplomacy and negotiations to get them through this political, I don't know, fiasco. Fair to say?
Yeah, so he's obviously hoping to be able to work this out by talking behind the scenes. Battling Donald Trump in public doesn't tend to go well. If past examples, particularly with the Canadian and U.S. government, are informative as to what to expect. So they're hoping that they can chat behind the scenes to explain that it is in fact in the U.S. national interests as well as Canadian national interests that neither side restrict the flow of essential personnel or restrict the flow of masks going across the border, because what affects one country very much affects the other, not only in terms of health, but the economy, socially, in all kinds of different ways. We don't know exactly which masks Doug Ford is making reference to. I spoke with a senior government official, and they say they're not aware of any federal shipments that have been intercepted or stopped. Doug Ford is saying that a shipment for Ontario was. We're trying to get to the bottom of what's going on there, of where the shipment was coming from, of who stopped it, of why it was stopped. Those are questions we don't have answers to yet, but I expect that this is going to be a question that comes up very shortly when the Deputy Prime Minister sits down and gives her daily briefing along with the ministers there, and of course for Premier Ford himself, who will be having a press conference this afternoon as well, as we try to figure out where. Federal government told me they are not aware this has happened to any federal shipments or any shipments at all at this point. So we're still trying to really figure out what is going on there, but obviously with the kind of shortage of masks and equipment we're talking about, and with the Premier saying that Ontario could run out within a week, every mask counts.
And we're also hearing about the mobilization of the Canadian Armed Forces. We heard that last week in Quebec and now in Ontario. What's the latest on that front?
So at this point, there's only been one provincial request, and that request has come from Quebec, and it's only up in northern Quebec to help with processing people who are lining up for testing or treatment for COVID-19 in communities up there. But what we are hearing, and folks around Toronto are going to see this today, you will see a large number of soldiers and military vehicles on the highway. They are going up to CFB Borden. They're going to be there so they can pre-position, and that means that then when a request comes in, they're good to go and they're able to respond much more quickly. That request does not come in a formal way yet, but remember, military planners are sitting in these provincial meetings on a daily basis. They are talking behind the scenes. So when that request comes for the military, if it comes, the military will already know that it's coming before the official request comes in and will be positioned to do so. So keep an eye on what those vehicles are going to be doing in coming days.
Our Ottawa Bureau Chief, Mercedes Stevenson, thank you so much. Let's head back overseas and bring in our Europe Bureau Chief, Crystal Gamansing, joining us from London. And we talked about the personal protective equipment in Canada. Crystal, what's the situation in Europe and specifically in the UK, which really it's getting much worse there? Italy and Spain have sort of, fair to say, maybe have hit the peak or at least are close to the peak. Talk about the shortage overall.
The PPE issue is just a problem right around the world. And of course, it is drastic because we need these frontline workers to have these incredibly important pieces of equipment. All
right, we are having some technical issues connecting with Crystal Gamansing, but let's bring in Ottawa Bureau Chief Mercedes Stevenson once again. And we talked about the military, Mercedes, and I want to ask you about some of the repatriation efforts as well. A big issue, a number of flights over the weekend. We've seen dozens of flights over the past few weeks. What's the latest on that? It's fair to say that a lot of people, the Foreign Affairs Minister even acknowledged that there will be many people simply forced to stay where they are, aren't they?
Yeah, not everyone will be able to come home. And as it is, anybody who has symptoms can't get on a plane and come home because there's concerns about them infecting other people on the flight and here in Canada. So there are still flights going back and forth. They are still ferrying many Canadians home. We're talking about hundreds and hundreds of people that have been brought back at this point. So they are making a very strong effort, but they're warning, look, we simply can't get everyone out. And in countries where the airports are closed, it's a lot harder to do that. I mean, here in Canada, we've got more limits on travel, but the airports haven't shut down completely. That has been the case in some countries, which makes it very difficult to get people out. Canadians who are aboard the cruise liners in Florida, they're still trying to work on ways to try to bring them home. So certainly lots of challenges ahead still for the department, but some folks will have to hunker down where they are, and the government has said they will supply up to $5,000 for them to be able to pay off some of the costs of staying there when they weren't expecting to.
And a lot of checkpoints being set up within Canada. Talk about that if you can. We heard some of the border restrictions and the limits of travel within Quebec, but we're seeing it across the country play out in some respects.
This in and saying that they want to restrict travel between the provinces. I mean, here in Ottawa, it's a great example. A lot of people live on one side of the river and work on the other side between Ontario and Quebec, and you have to show ID to prove that you can go back and forth. So provinces really trying to crack down on that, especially provinces who don't have high infection rates right now, and they're concerned that people from other provinces with higher infection rates could come across and could spread COVID-19.
Our Ottawa Bureau Chief Mercedes Stephenson, thank you so much. We'll have to leave it there. So if you are just joining us, here's a quick recap of what the Prime Minister announced today. You can now apply for the CERB online. You can do that 24 hours a day. More than 240,000 people have already applied. That number is going to spike dramatically. Also promising new help for students and those who don't make enough make as much as the benefits. So we'll learn some of that in the coming days. Obviously, a lot we will learn in the coming days, in the coming hours. For everyone here at Global News, I'm Anthony Robart. Thank you so much for watching. The latest news and information will be on globalnews.ca and Global National.
Patienter, la conférence débutera sous peu. Durant la séance de questions-réponses, si vous avez une question, appuyez sur étoile 1. Si vous utilisez un téléphone main libre, s'il vous plaît.
Bonjour et merci de vous être joint à nous aujourd'hui. Canadians must continue to practice physical distancing. Please stay strong and stay at home. I know how hard it is. It's so important. Unless, of course, you are doing essential work like stocking grocery shelves, or you're on the front lines of our healthcare system. And if you are doing that essential work, thank you very much. I know that many Canadians today are struggling to make ends meet. That's why I'm glad to be able to say that applications for the Canada Emergency Response Benefit are now open. To make sure the system works, we are staggering the days Canadians can apply based on their birth month. We Canadians are resilient. We are survivors. I know we will get through this together. Les Canadiens et Canadiennes doivent continuer à pratiquer la distanciation physique. Restez forts et restez à la maison, à moins que vous fassiez un travail essentiel, comme remplir les tablettes à l'épicerie ou fournir des soins de santé. Je sais que les Canadiens et Canadiennes souffrent. C'est pourquoi je suis heureuse de dire que les Canadiens et Canadiennes peuvent maintenant postuler à l'aide de la prestation canadienne d'urgence. Pour nous assurer que le système fonctionne bien, nous échelonnons selon les mois de naissance les jours durant lesquels les Canadiens et Canadiennes peuvent postuler. Les Canadiens et Canadiennes sont résilients. Nous allons passer à travers ensemble. Okay, and today we are going to hear from Canada's Chief Public Health Officer, Dr. Theresa Tam, and the Deputy Chief Public Health Officer, Dr. Howard New, et le Président du Conseil du Trésor, Jean-Yves Duclos, and of course, Canada's Minister of Health, Patty Hajdu, is here and also available to answer your questions. Thank you. Dr. Tam, please.
Hello, everyone. As usual, I'll start with the update on the numbers of COVID-19 cases in Canada. There are now 15,822 cases with 293 deaths. Most concerning are new outbreaks in hospitals and long-term care facilities, which are occurring in several provinces. As well, we are hearing of young people being hospitalized due to COVID-19 and people as young as in their 20s dying of the disease. This is a serious health threat to everyone. And although older ages are most at risk, no one can predict when critical illness will strike someone at any age. On the lab front, over 339,000 people in Canada have been tested to date, with about 5% confirmed as positive, and we'll continue to test at a high rate to track where spread is occurring. In good news, British Columbia recorded a lower number of cases this week compared to last. While it is still too early to tell, this continues to encourage us that our collective action can slow the spread of this pandemic. And though there is cause of cautious optimism, we must not relax any of our efforts, from practicing physical distancing, frequent hand washing, and covering coughs to protect our most vulnerable. As I noted yesterday, our collective scientific knowledge of COVID-19 continues to grow. Now that more countries have had larger number of cases and have analyzed transmission patterns, it is clear that transmission of the virus is happening more often than previously recognized from infected people right before they develop symptoms. This is called pre-symptomatic transmission. There is also evidence that some infected people who never develop symptoms are also able to transmit the virus. This is called asymptomatic transmission. We still do not know how big a role pre-symptomatic and asymptomatic transmission play in driving this pandemic, but we know that it is occurring. With this emerging information, the Special Advisory Committee on COVID-19 has come to a consensus that wearing a non-medical mask, even if you have no symptoms, is an additional measure that you can take to protect others around you. In situations where physical distancing is difficult to maintain, such as in public transit or maybe at a grocery store, a non-medical mask can reduce the chance of your respiratory droplets coming into contact with others or land on surfaces. So wearing a non-medical mask in the community has not been proven to protect the person wearing it. It is an additional way that you can protect others. Wearing a non-medical mask in the community does not mean you can back off the public health measures that we know work to protect you. So you must continue to practice physical distancing and good hygiene, like frequent hand washing and regularly disinfect high-touch surfaces. And I want to emphasize that it's extremely important that we keep the supply of medical masks where it is needed. Healthcare workers need medical masks. We are still in a very critical stage of Canada's COVID-19 epidemic, and this is no time to relax our preventive measures. As Canadians, we may not outwardly demonstrate our pride, but our hearts are full of it, and we are determined people. When someone says flatten the curve, we say we'll plank it. We are stronger together, and we will get through this together. Donc, ça va bien aller. Thank you.
It will be okay.
Thank you, Dr. Tam. Dr. New, please.
OK. Bonjour. Comme d'habitude, on va commencer en faisant le point sur le nombre de cas de COVID-19 au Canada. On compte en ce moment 15 822 cas au pays, dont 293 décès. Ce qui nous inquiète de plus, ce sont les éclosions dans les hôpitaux et les établissements de soins de longue durée, un problème auquel plusieurs provinces sont confrontées. Nous savons aussi que des jeunes sont hospitalisés à cause de la COVID-19 et que des personnes d'à peine 20 ans meurent de la maladie. Il s'agit d'une menace sérieuse pour la santé de tous. Et bien que les personnes âgées soient les plus à risque, personne ne peut prédire à quel moment une personne tombera gravement malade, quel que soit son âge. Du côté des laboratoires, plus de 339 000 personnes ont subi un test de dépistage au Canada. Environ 5 ont reçu un résultat positif et nous continuons d'effectuer de nombreux tests pour déterminer où se propage la maladie. Il y a aussi de bonnes nouvelles. Cette semaine, la Colombie-Britannique a enregistré moins de cas que la semaine dernière. Bien qu'il soit encore trop tôt pour nous prononcer, cette baisse continue de nous pousser à croire que notre action collective peut ralentir la propagation de la pandémie. Même si nous pouvons nous promettre un certain optimisme, nous ne pouvons pas relâcher nos efforts qu'il s'agisse de pratiquer l'éloignement physique, de nous laver souvent les mains, de nous couvrir la bouche pour tousser ou de protéger les personnes les plus vulnérables. Comme on a mentionné hier, notre connaissance scientifique collective de la COVID-19 ne cesse d'augmenter. Maintenant que nombre grandissant de pays ont enregistré de nombreux cas et analysé les modes de transmission, on se rend compte que les personnes infectées transmettent le virus plus souvent qu'on ne le pensait, c'est-à-dire juste avant de présenter des symptômes. C'est ce qu'on appelle la transmission pré-symptomatique. Il est également prouvé que certaines personnes infectées peuvent transmettre le virus sans jamais présenter de symptômes. C'est ce qu'on appelle la transmission asymptomatique. Nous ne savons toujours pas quel rôle joue la transmission pré-symptomatique et la transmission asymptomatique dans la progression de la pandémie, mais nous savons qu'il existe. Sur la base de ces nouvelles informations, le Comité consultatif spécial sur la COVID-19 a convenu d'un commun accord que le port d'un masque non médical, même si vous ne présentez aucun symptôme, est une mesure supplémentaire que vous pouvez prendre pour protéger les personnes de votre entourage. Dans les situations où la distance physique est difficile à maintenir, par exemple dans les transports en commun ou à l'épicerie, un masque non médical peut réduire le risque que vos gouttelettes respiratoires entrent en contact avec d'autres personnes ou atterrissent sur les surfaces. Il n'a pas été prouvé que le port d'un masque non médical dans la communauté protège la personne qui le porte. C'est une façon de plus de protéger les autres. Le port d'un masque non médical dans la communauté ne signifie pas que vous pouvez renoncer aux mesures de santé publique qui, nous le savons, permettent de vous protéger. Vous devez continuer à pratiquer l'éloignement physique et avoir une bonne hygiène, comme vous lavez souvent les mains et désinfecter régulièrement les surfaces qui sont fréquemment touchées. Par ailleurs, on tient à souligner qu'il est extrêmement important que nous gardions les masques médicaux pour les personnes qui en ont le plus besoin. Les travailleurs de la santé ont besoin des masques médicaux. Nous sommes toujours à une étape très critique de l'épidémie de COVID-19 au Canada et ce n'est pas le moment de relâcher nos mesures préventives. En tant que les Canadiens, en général, nous extériorisons peut-être pas notre fierté, mais notre cœur est rempli et nous sommes un peuple déterminé. Quand quelqu'un dit « aplatissez la courbe », nous répondons que nous allons l'aplatir. Nous sommes plus forts ensemble, nous nous en sortirons ensemble. Ça va bien aller. Merci.
Merci beaucoup, Dr. New. Et maintenant, je donne la parole au président du Conseil du Trésor, Jean-Yves Duclos. Jean-Yves.
Merci, Christia. Bonjour tout le monde. Good morning, good afternoon, everyone. Le premier ministre Trudeau a fait 3 annonces importantes ce matin, de bonnes nouvelles du point de vue économique et du point de vue de l'appui du gouvernement canadien à toutes ces familles, à tous ces gens qui en ont absolument besoin de cet appui dans les conditions difficiles que nous vivons. La première bonne nouvelle, c'est le lancement ce matin du site pour déposer des demandes pour la nouvelle prestation canadienne d'urgence. 300 000 personnes ont déjà déposé avec succès une demande sur le site ce matin. Le site fonctionne bien, le site est solide. Nous continuons à travailler très fort pour qu'il le continue. Et une raison pour laquelle ce site fonctionne bien, c'est que les Canadiens sont disciplinés et déposent leurs demandes en fonction de leur mois de naissance. Aujourd'hui, les mois de naissance, c'est janvier, février et mars. Une deuxième bonne nouvelle en termes d'appui du gouvernement canadien aux Canadiens et aux Canadiennes, c'est que les 2,5 millions de demandes d'assurance emploi qui ont été faites au cours des dernières semaines sont traitées rapidement. 2,5 millions de demandes en quelques semaines, c'est plus que ce que le gouvernement canadien reçoit généralement durant une année complète. De ce 2,5 millions de demandes, il y en a 2,1 millions qui ont été traitées au cours des 2 dernières semaines. Alors, dans 2 semaines, il y a à peu près le même nombre de demandes d'assurance-emploi qui ont été traitées que celles qu'on traite généralement en 1 an. On rappelle que ces personnes qui ont déjà déposé une demande d'assurance l'assurance-emploi n'ont pas besoin de demander une prestation canadienne d'urgence puisque leur demande d'assurance-emploi est automatiquement acheminée vers une demande de prestation canadienne d'urgence. Et la dernière bonne nouvelle, c'est que nous avons tous un rôle à jouer en matière sanitaire, mais aussi en matière économique. Le système bancaire, incluant le mouvement coopératif et Desjardins, ont aussi un rôle très important à jouer. Donc, on est heureux d'apprendre qu'ils ont réduit de manière importante les taux d'intérêt qu'ils demandent sur les cartes de crédit et on s'attend et on espère que le secteur bancaire va continuer de faire en sorte que tous et toutes fassent leur part. On va tous sortir de cette crise ensemble et on est heureux donc de la collaboration de l'ensemble des acteurs économiques. Merci, Christian.
Merci, Jean-Yves. On est prêt à répondre aux questions.
Merci. Alors, comme d'habitude, 3 questions au téléphone, 3 questions dans la salle. One question, one follow-up. Operator.
Thank you. Merci. Please press star 1 at this time if you have a question. S'il vous plaît, appuyez sur étoile 1 maintenant pour poser une question. The first question is from Micheline Laflamme de Radio-Canada. La parole est à vous.
Floor is yours. Micheline Laflamme.
Oui, bonjour. J'aimerais savoir, en fait, on a reconnu que la PCU ne rejoint pas tous les besoins de milliers de Canadiens qui ont perdu leur revenu. Alors, quels sont les travailleurs qui vont être touchés particulièrement par ce que vous allez annoncer? Est-ce que ça va être rétroactif? Et aussi, allez-vous faire des ajustements à la subvention salariale aux entreprises qui, selon plusieurs dirigeants, ont trop d'obstacles et donc ils ne peuvent pas y accéder?
Merci pour la question. Et comme on sait, nous sommes dans une situation d'urgence qui demande des mesures d'urgence. Et c'est pour ça que depuis déjà quelques semaines, on fait ce qui est normalement exigible en des mois ou des années de travail de la part du gouvernement fédéral, c'est-à-dire répondre à des besoins essentiels, des besoins substantiels, des besoins urgents d'appui à nos travailleurs et à nos entreprises. La prestation canadienne d'urgence, le premier ministre l'a abordé un peu plus tôt ce matin dans son point de presse. On sait qu'elle couvre beaucoup des travailleurs qui en ont besoin et ça inclut des travailleurs qui n'auraient normalement pas droit à une prestation en situation de chômage ou de perte de revenus de la part du gouvernement fédéral, c'est-à-dire tous les travailleurs qui n'ont pas droit normalement à l'assurance-emploi, les travailleurs autonomes, ceux qui n'ont pas accumulé suffisamment d'heures, ceux qui se retrouvent en situation de zéro revenu pour des raisons qui n'ont pas de lien avec leur situation, de lien d'emploi avec leur employeur. Mais ceci étant dit, il y a encore des trous dans la couverture de la prestation canadienne d'urgence et c'est pour ça que le premier ministre Trudeau a identifié ce matin 3 catégories de gens pour lesquels du travail additionnel est en train de se faire avec évidemment la collaboration de la ministre Qualtrough et du ministre des Finances, M. Morneau. Si je résume, les 3 sur lesquels on travaille particulièrement fort ces temps-ci, ce sont ceux qui ont perdu beaucoup d'heures de travail, mais pas nécessairement toutes leurs heures de travail et donc tous leurs revenus. On parle de gens qui n'auraient pas présentement un revenu aussi élevé que le 2 000 $ de prestations canadiennes d'urgence. Et on parle finalement aussi d'étudiants qui, dans certains cas, vont avoir la difficulté à trouver un emploi au cours des prochaines semaines et des prochains mois. Par contre, rapidement, sur la question des étudiants, laissez-moi vous rappeler ce qui existe déjà pour les aider. Un, c'est un report d'au moins 6 mois des versements de capital sur leur dette de prêt, sur leurs prêts étudiants qu'ils auraient pu contracter au cours des derniers mois, des dernières années. Donc, ils n'ont pas besoin de payer leur capital au cours des 6 prochains mois. Et en plus, l'intérêt qui aurait été accumulé au cours des 6 prochains mois, cet intérêt-là est totalement annulé. La deuxième chose, c'est que la prestation canadienne d'urgence, elle profite déjà à plusieurs étudiants qui ont accumulé au cours de la dernière année 5 000 $ de revenus et qui ont pu perdre leur emploi dans le secteur de la restauration, dans le secteur des services, comme employés aller à l'université ou dans un cégep. Donc, ces étudiants ont déjà droit maintenant à la prestation canadienne d'urgence. Et la troisième chose qu'on a déjà mise en place, qui est très importante pour les étudiants, c'est cette subvention salariale de 75 % qui amène les employeurs à engager et à réengager des travailleurs, dont des étudiants qui auraient autrement été sans emploi et sans revenu. Finalement, sur la question de la subvention salariale elle-même, et comme on sait, comme c'est très important, le ministre Morneau travaille très fort pour en préciser tous les détails.
Oui.
Et si je peux seulement ajouter une phrase en français que peut-être Jean-Yves peut répéter en anglais. Concernant les gens qui travaillent 10 heures par semaine ou moins, ça inclut évidemment les pompiers volontiers, qui sont une catégorie très importante pour beaucoup de municipalités canadiennes. Et nous avons discuté la situation. Beaucoup de députés ont soulevé cette question et on va régler cet enjeu important.
Very key issue.
So thank you. I'll say that briefly in English. So what is currently happening is that the federal government is reacting in an emergency situation and in an emergency manner, which we haven't seen in the history of the social safety net of Canada. So that means that we are putting into place things like the Canada Emergency Response Benefit, things that would normally take months, if not years, to implement. We're doing this because we know that what already exists is helping millions of Canadians, and we're seeing this morning the impact of that with more than 300,000 applicants already having successfully deposited their request for a CERB. Now, we know, as Prime Minister Trudeau said just a moment ago, that there is more to do. And there are three categories of people that Prime Minister Trudeau focused on just a moment ago. First, those that have reduced hours of work but have not lost all of their income or all of their hours of work. So we're mindful of that. Also, those that would be receiving less in income than the $2,000 per month of the Canada Emergency Response Benefit, and those like students that would have a hard time finding a job at a moment in the year at which they would normally be trying to find a job to pay for their expenses. Now, the good news about the students is that although there will be more to come, they have already been many important things for them. First is the delay for at least 6 months of their payment for their student loans. So the capital payments can be brought forward by at least 6 months, and all of the interest that would normally accrue on their loans will not be payable at all. So there will be no interest paid not only in the next 6 months, but that interest that would normally be paid in the next 6 months will not be asked for afterwards. The second thing is that the Canada Emergency Response Benefit is already helping thousands of students right now, because there are thousands and probably hundreds of thousands of students that have earned more than $5,000 in the last year, but that have lost their job, sometimes their part-time job in a restaurant or in a shop or at university as an assistant to their teacher. So there would be students that have lost their jobs, that had earned enough income last year, and that are eligible to asking for the Canada Emergency Response Benefit right now this week, starting today and the rest of the week. And finally, the wage subsidies. Those wage subsidies are very substantial. They will encourage and support businesses towards either rehiring or hiring students that would otherwise have lost their jobs. So this we expect will also be very important for the students in the next weeks, in addition to things that the Prime Minister said we would announce shortly.
Thank you, Minister. Micheline, en suivi.
Oui, merci. Et puis, en ce qui concerne l'arrivage de masques qui provenaient des États-Unis, qui étaient destinés à l'Ontario, là, le premier ministre Ford a dit que ça a été prohibé. Alors, qu'en est-il et quel est l'état de la réserve nationale en ce moment?
J'ai discuté cette situation avec le premier ministre Ford il y a 15 minutes avant notre conférence de presse. On est très engagé avec toutes les provinces et on travaille. On fait du travail acharné avec les États-Unis pour nous assurer que tous les masques qu'on a achetés peuvent être exportés au Canada. Et on a eu des conversations positives et on continue de travailler à régler cette situation très importante pour notre pays. Concernant la situation avec les soins médicaux en général, toutes les provinces font du travail acharné, le fédéral aussi. C'est vrai que la situation en Ontario est une situation qu'on connaît très très bien. On a une très très bonne communication avec la province, avec le Premier ministre, et on va continuer de travailler très très fort pour assurer que les gens qui font le travail essentiel pour nous protéger dans nos hôpitaux ont les équipements duquel ils ont besoin. Sure. So we are very aware of the situation that Ontario experienced with some masks it had purchased in the United States and having some trouble getting them across the border. I spoke about that with Premier Ford just a few minutes before this press conference. And immediately called Ambassador Hillman, who is now very seized of the issue also. More broadly, we have been working throughout the weekend very, very hard with our American neighbors to ensure that medical supplies can continue to flow across the Canada-U.S. border. And let me emphasize, as we emphasized in our conversations with our American neighbors, that flow is a two-way street. The relationship when it comes to medical supplies, when it comes to healthcare between Canada and the United States is, like all aspects of our economic relationship, very balanced, very reciprocal. And that is why a win-win outcome where both parties continue to help each other is the very best outcome. That is the point we have been making. And we had some positive conversations over the weekend, and we're going to continue to have those conversations.
Thank you, Deputy Prime Minister. Next question.
Thank you, merci. The next question is from Alex Ballingal from the Toronto Star. Please go ahead.
Hi, thanks for taking my question. Just to expand on that, Premier Ford put out a statement this morning saying that Canada is working to try and get an exemption from the U.S. order on preventing the export of PPE. I'm wondering if you can confirm that and expand on what exactly these productive talks are about that you're having with the Americans.
Yeah, exactly that. We believe that the flow of medical equipment through the supply chain between Canada and the United States needs to continue unimpeded. And that, of course, is a two-way street. Both countries benefit from this, and both countries would lose out if hurdles were to be put in the way of that flow of healthcare support between our two countries. We made that point in repeated conversations over the weekend and today. As the Prime Minister said, we feel we are being heard, and we look forward to a definitive resolution of this situation. It's in the interests of both countries to continue supporting each other when it comes to healthcare. Let me just add, I also spoke to the global CEO of 3M, Mike Roman, who has been doing a great job. The company is taking a very, very responsible position. They understand the very special place they are in right now. And I would really like to commend the company for its approach and for its very constructive relationship with Canada.
Alex, follow up?
The Prime Minister mentioned shipments from other countries have been delayed and there's been stuff missing from shipments that have arrived. Do you have any more details on which countries had shipped things that were delayed and exactly how much stuff has been missing from the shipments that have arrived in recent days?
Look, as Minister Hajdu, as Patty pointed out at one of these press conferences last week, it is really a wild west when it comes to buying medical supplies right now. This is a global pandemic, and every country in the world is doing its best in a truly fierce competition to get medical equipment. Canada, working very closely with all of our provinces, is working really, really hard in the international marketplace to get all the supplies we need. It's hard, but that's why we have to work even harder. And it is also why I am so grateful to all of the Canadian manufacturers right across the country who are stepping up to figure out ways that we can make the medical equipment, the testing equipment that we need here in Canada. So it's a two-pronged approach. We are working hard, but it is absolutely very, very tough right now.
Thank you, Deputy Prime Minister. Operator, next question, please.
Thank you, merci. La prochaine question de Marie Vassel, Le Devoir. La parole est à vous.
Marie Vassel, Le Devoir.
Oui, bonjour, Madame Freeland. J'aimerais continuer là-dessus en français. Pouvez-vous confirmer que votre gouvernement cherche à obtenir une exemption des États-Unis sur cet ordre de cesser les exportations d'équipements médicaux? Et vous avez dit aussi en anglais que you're looking forward to a definitive resolution. Pouvez-vous nous dire quand est-ce que vous attendez une réponse à cet effet des États-Unis ou combien de temps vous êtes prêt à attendre?
Oui, je peux confirmer que la position du Canada est que on doit continuer avec les États-Unis d'avoir le commerce dans les soins médicaux qu'on a jusqu'à ce moment. Je veux souligner pour les Canadiens ce que le gouvernement du Canada a souligné dans nos conversations avec nos homologues américains. Et c'est que c'est une relation réciproque. Le Canada exporte beaucoup d'équipements médicaux et aussi nos professionnels font du travail extraordinaire aux États-Unis. C'est bon pour les Américains. En même temps, le Canada, les États-Unis exportent des équipements médicaux qui sont nécessaires pour nous. Continuer d'avoir cette relation réciproque est dans les intérêts de tous les deux pays. Nous avons maintenant une relation gagnant-gagnant et c'est ce que nous voulons préserver. On a eu beaucoup de conversations pendant le fin de semaine et aujourd'hui concernant cet enjeu. Les conversations étaient positives et nous espérons que ce sera possible très vite de régler définitivement cette situation.
Ouais, OK. Et pour ce qui est de l'entreprise 3M, vous dites que vous êtes entretenu avec eux cette fin de semaine. Avez-vous obtenu des assurances dans leur déclaration vendredi dernier? L'entreprise semblait réticente à cesser d'exporter ses masques vers le Canada. Avez-vous obtenu des assurances que 3M va ignorer l'ordre de Washington et qu'on va recevoir les commandes qu'on avait placées chez eux?
Je ne suis pas d'accord avec la proposition dans la question. Ce n'est pas pour une compagnie, une entreprise d'ignorer les lois de sa propre pays. c'est pour les pays de régler ces relations entre eux. Concernant 3M, on a une conversation constructive. L'approche de 3M, j'apprécie beaucoup, c'est très responsable. Et on a discuté ce que 3M a besoin du côté d'États américains pour continuer d'exporter ces masques au Canada. On a aussi discuté avec 3M un élément central et c'est la dépendance mutuelle, la dépendance réciproque de nos deux pays.
Merci, Madame la Vice-Première ministre. We'll now turn to the room, starting with Julie, CBC.
Yeah, Ms. Freeland, you were saying that you spoke to Doug Ford 15 minutes before you came here. He talked about some masks and some trouble at the border. So how many masks, where were they coming from, what was the trouble, and exactly how are you going to resolve this?
I'm going to let Premier Ford talk about the specifics of this particular province of Ontario purchase as he chooses. We did speak about the fact that some masks that the province had purchased in the United States were having some difficulties in being shipped across the border. And I pledged to the Premier that the federal government would do everything we can to get those masks into Canada, and we will.
All right. I have other questions for you, but unfortunately I have to move to masks. Now, Theresa Tam, about the cloth masks that you say is probably beneficial for Canadians to wear right now. Why would it have taken so long, considering we know how infectious this virus is, and we know that people can carry it and not know it? So a mask, how could that have hurt? Why didn't you say weeks ago, wear a cloth mask?
So the evidence is actually still quite weak. What the evidence that just came to light in, I would say, the last 10 days actually came from a few studies about asymptomatic and pre-symptomatic illnesses. So I think, as I was trying to explain yesterday, there's several different types of studies, and they were published, a number of them in the last little while. So they are very specific studies in long-term care facility, the Diamond Princess cruise ship, and a hospital setting, for example, and a study from Singapore. And then that last one was released on April 1. So you have to take the evolution of the evidence as rapidly as possible. And so the viral load studies show that, yes, people who are just before they develop symptoms have high viral loads. And so that tells us that the possibility is there that they can transmit. We still don't know exactly how important transmission from the pre-symptomatic or asymptomatic people are in driving this epidemic. There are other epidemiologic studies as well, for example, in the Seattle long-term care facility. So these are very recent studies that's just come out on this particular virus. And so we very rapidly try to integrate that latest science. On the issue or the area of wearing masks to protect others, which is what we're talking about is non-medical masks, which may be made of cloth, for example, for people making it at home. As an added layer of protection is a bit like covering your cough. I think the Special Advisory Committee looked at the literature around the use of masks for this sort of source control, and it's actually mainly from influenza studies, and they are not very clear. So we want everybody to be aware that the science is not certain, but we believe in we need to do everything that we can. It seems a sensible thing to do. So I think we recommend that Canadians can take this additional measure at instances where social distancing is difficult to maintain. So our strongest message really is that you must continue to do social distancing, that 2-meter bubble, and hand washing, stay home, you're safe. All of those things are the effective measures this may add a layer of protection to prevent you from transmitting someone to others before you actually know that you have the illness. So I think that needs to be very clear. And the other key message, of course, is that medical masks right now, as you've just heard about the challenges with supplies, that they must be preserved for our health workers and others who are looking after patients.
Thank you, Doctor. Next question.
And with CTV National News. Over the last couple of days, you have said that people shouldn't wear medical masks. So you're asking people to essentially wear non-medical masks now as a way to prevent themselves and others from spread. But I'm just wondering if you could be clear for Canadians on the guidelines when you say non-medical mask. What are you talking about? Because now, hardware stores are closed. Lots of Canadians at home might be looking to make a homemade mask. So what are you suggesting they wear? What are those guidelines?
Yes, so we'll be, we have some suggestions on our website, but we'll be putting out more additional tools for people to think about. So we're talking about things that are readily available in anyone's home, things like cotton shirts, sheets, bandanas, and other materials. But we're also going to tell people things that they shouldn't use as well. And we have our engineers looking at the evidence on those. But I think it's simple things that not complicated, and preferably no sewing required, because I, for one, can't sew anything. So if you can get a cotton material, like a T-shirt, you cut it up, you fold it, and then put elastic bands around it, other sort of non-medical facial coverings that we're talking about. And we will see what kind of tools we can provide in short order.
I just wanted to ask you a follow-up question on test kits. Over the last number of days, we've been asking you a lot of questions about shortages of personal protective equipment like masks, ventilators. How many test kits do we have in Canada at this moment? And can you give us a sense of how many test kits we might need should we see a dramatic number of cases increase and a number of people getting sick? Like, how many test kits do we have and how many do we need moving forward?
I think, as I've said, Canada is testing at quite a high rate compared to many other countries, and we're pulling out all stops again to improve the capacity in Canada. It's not a matter as simple as just a kit. Obviously, there are throughout that pipeline of testing, there are swabs, there are other pieces, but there are also reagents that people need to use to extract materials from the swab and then test it. So there are many different components, and right now Canada is doing well, but we are trying to make sure we get the right reagents. Like all supplies, the global supply chains are very difficult. So we are looking at how can we look at made in Canada solutions, and also we're at the moment looking at validating things like more rapid test kits, little equipment that can be then sent to, for example, the north or more remote areas that can't send their samples to a public health lab. And some of the initiatives are actually changing the testing capacity at the bigger labs into more high throughput machines and procedures. So it's not a matter of just counting kits. So again, efforts are all out on that, as well as, so that's mainly tests for the detection of the virus through PCR. And we're also, of course, working on looking at the antibody tests.
Thank you, Dr. Mike Global.
I guess I'm going to follow up with that. So why aren't we doing more testing? Is it because of the lack of resources or lab supplies or personnel? Is that why we're not testing a lot of these people who are asymptomatic or not pre-symptomatic?
Yeah, so we have, through our federal, provincial, territorial discussions, guidance provided. So for sure, we want the supplies to be utilized in the most effective way possible. So that does mean testing in situations where you're most likely to be finding infection and in the most high-risk situations. So like in outbreaks, in cluster detection, in healthcare workers, in highly vulnerable communities, including indigenous communities, they're absolute must, and we have to do well in long-term care facilities, for example. For others, we've already provided instruction that if you're sick, you must stay at home. And others are practicing social distancing to the effect that even if you're pre-symptomatic, you shouldn't be within the distance to spread it to other people, and with maybe added protection like these homemade masks. So the test doesn't actually drive potentially the public health action. So you want the test that you have and whatever you have on populations where you are going to make a decision after you've actually got the test result. So if you're just staying home anyways, we're going to be prioritizing others. We are looking, of course, and people are very interested in serologic testing, which will help us look at the level of immunity in certain populations and a little bit further on in our studies. And so that's a different approach, but it is one that we're pursuing as well. But the rate at which we test is quite high, but it is a bit different depending on where you're in Canada. So we want the resources to go to areas that are, for example, experiencing the highest activities as well.
Okay, and so we're just learning about this asymptomatic, pre-symptomatic things, but how are we going to get back to normal without higher levels of testing? Like if people are walking around with this virus that don't even know it?
Yes, so obviously when you're walking around, practice social distancing, of course. And so it's an extremely good question. And you're going to hear many sort of opinions, if you like, as to how many proportion of your population is asymptomatic and got the infection, which is precisely why we need to do studies, as time goes on. Because right now our focus is to tackle this actual outbreak. At some point in the near future, we will be looking at how do we apply serologic testing, for example, to look at the level of immunity in the population. And those kind of studies will let us know to what extent the virus has been affecting people in a very mild way or, very little symptoms, if at all. So those do have to be done, and it has to be also done in a global setting as well.
Thank you, Doctor. We'll now turn back to the phone. Operator.
Thank you, merci. La prochaine question est de Raymond Filion de TVA. La parole est à vous.
Oui, bonjour. Une question pour Dr. New au sujet du port des masques non médicaux. Je ne vous ai pas entendu prononcer le mot recommandation. Est-ce que c'est quelque chose que vous recommandez aux Canadiens ou pas?
OK. Merci pour la question. Pour commencer, je vais souligner quelques points très importants. Premièrement, si on parle des masques non médicaux, c'est aussi très important de dire qu'il faut consacrer, c'est absolument nécessaire, critique de consacrer les masques médicaux pour les personnes qui sont sur le terrain en première ligne. Ça veut dire les travailleurs de soins de santé. Ça, c'est point clair. Deuxièmement, un autre un point important, c'est que même si on parle de masques non médicaux, c'est très important de garder aussi les mesures parce que si on ne faut pas donner comme une fausse sens de sécurité aux gens. Si je porte un masque, c'est pas nécessaire de pratiquer l'éloignement physique, de se laver les mains, tout ça. Non, c'est absolument critique de continuer avec les bonnes hygiènes et les pratiques de santé publique. Troisièmement, si on parle des masques non médicaux, ça ligne avec ce qu'on a déjà dit que oui, si on est peut-être malade, si on tousse, il faut toujours tousser dans la manche. C'est une autre mesure supplémentaire au lieu de peut-être tousser dans la manche, peut-être c'est dans un masque non médicaux. Et un autre point important, c'est que si on utilise un masque non médicaux, c'est plus peut-être pour protéger les autres. C'est pas pour nous protéger contre les autres. parce que si on tousse, ça peut attraper peut-être les gouttelettes respiratoires et aussi peut-être pour contaminer des surfaces. Comme on a dit avant, le comité consultatif spécial sur la COVID-19, on a convenu une commun accord et tous les médecins hygiénistes en chef de toutes les provinces et territoires sont d'accord que c'est une autre mesure supplémentaire. C'est quelque chose, on peut en servir, mais ce n'est pas comme une recommandation. C'est comme dire un conseil permissif. Merci.
Très bien. Donc, ce n'est pas une recommandation, c'est compris. Question de suivi pour M. Duclos. On reçoit beaucoup de courriels au sujet des pompiers volontaires. Vous en avez parlé vendredi. Qu'est-ce qu'il en est? Est-ce que c'est maintenant officiel que les pompiers volontaires pourront recevoir de la prestation canadienne d'urgence ou non?
La réponse est oui.
C'est fait. Merci.
Okay. Next question.
Thank you. The next question is from Christy Kirkup from the Globe and Mail. Please go ahead.
Hello, good afternoon. Thanks again for doing this. My question pertains to the now confirmed cases, particularly in First Nations that have confirmed cases in recent days. And I know the Chief Public Health Officer has already said that even one case in Indigenous communities has the potential to be devastating. I'm just wondering, I know the government has already earmarked some funding, $305 million for Indigenous community support, but what is being done in the immediate term to support communities like one in Northern Ontario that doesn't have water and now has this confirmed case of COVID-19?
Thank you, Kirsty. I spoke with Chief Bellegarde this morning about that particular case up in northwestern Ontario, and also will be speaking with Chief Fiddler later today, sort of in my neck of the woods as a Northern Ontario Member of Parliament. And I will say that according to Chief Bellegarde, the person is self-isolating. You're right. It is way more difficult to self-isolate and to practice regular hand washing and regular cleansing when you have a situation where there maybe aren't those kinds of facilities or people are crowded in overcrowding situations. I know my colleague Minister Miller has been working very carefully with all of the First Nations leaders around their own pandemic plans, of which First Nations communities have, and is working to make sure that they have the resources they need to provide the appropriate medical care and the appropriate follow-up, as well as additional supports if people cannot properly self-isolate. I can't speak to this specific case in terms of where they're at, but I do know that Chief Bellegarde feels very confident that our government is taking this seriously and that we're there to support First Nations and ensuring that they have the measures they need when cases are identified. And I'll turn to Dr. Tam to speak a little bit more about Indigenous communities. I can just add to that. I think what Dr. Tam has said in the past was ultimately, at the end of the day, social distancing is the best protective factor. Staying 2 meters away from people, making sure that you're observing the practices of protecting those around you by making sure that you maintain that distance. But there may be times where you are not able to. For example, if you're taking public transit and you know that your bus is likely to be crowded that morning, if you have to go to the grocery store and you're uncertain about whether or not the store is following practices that allow you to continue social distancing. And so I think that's why it's difficult to say universally that this is a recommendation, but there are certain circumstances where an individual may feel that they are not able to practice the social distancing or physical distancing, if you will, of 2 meters and would like to take additional measures to protect the people around them.
Okay, so as I understand it, you recommend it on top of social distancing when you cannot do social distancing. And my other question, but anyways, I don't see why you just go ahead and say we are recommending this on top of everything else. Anyways, my other question, Dr. Tam, is can you explain to me if you are keeping tabs on hospital stays, and are you looking at that at all? Do you have all the data from all the provinces, and is that helping for you to assess the situation?
Yes, you can find some of this information on our websites as well. We don't have hospitalization status on every single case, and these come from the provinces and territories. And of course, a patient's clinical status can change over time. But we do know that based on the information that we have, if you just looked at the more real-time data that provinces have been communicating, we do know the percentages of cases right now in terms of deaths and hospitalizations. And it has been, again, it depends on where you are in the country, but it has been around sort of the 8 to 10% mark. But we do have a subset of data where you can find it on our website in terms of age breakdowns, for instance, which again tells you that the people most at risk of serious illness are really people over the age of 80, over the age of 70. But you will see that younger age groups are also impacted by hospitalizations and deaths.
Thank you, doctor. Ceci met fin à la conférence de presse pour aujourd'hui.